Welcome to the InfoWars Nightly News. I'm David Knight. It's Monday, October the 20th, 2014. Here are our top stories.
Tonight, President Obama's plan for an Ebola strike force. Then, New York police request Facebook passwords from gun applicants. And how the CDC director is tougher on sodas than Ebola. That's next on the InfoWars Nightly News.
You've heard the big White House reporters when the mics they think are off going, man, we're screwed. This is really bad. It's spreading. But when they ask the questions, oh, gracious leader, thank you for saving it.
Well, today the quarantines ended for the fiancé of the man who brought Ebola to America from Liberia and for those who were staying in the apartment. And she had some kind words for those treating her fiancé. She said, "My beloved fiancé did not survive with us. Our hearts also go out to the two brave women who've been infected by this terrible disease as they were trying to help him." And then she went on and kind of got strange because she singled out the mayor as well as the Dallas judge who had put in the quarantine order and said that they cared about her as a person. And then she thanked the Dallas mayor and the judge who put her and her immediate family in quarantine. She said that they cared for her very much as a person. But think about this. As they quarantined them, it was a couple of days into the quarantine that they realized that this family and another one, her daughter's family, did not have any food. They'd put them in quarantine, did not give them any food. They don't think they were thinking too much about them as a person. Eventually, that need was not met by the county, not met by the judge or the mayor. It was met by the Red Cross and private charities, and they allowed them to break quarantine when they did it. Then that judge who had put her in quarantine made a point of breaking the quarantine. So is this some kind of Stockholm syndrome? If he really cared about her. And so when I look at their actions, I ask, was she quarantined needlessly? Or were they just playing Russian roulette with the public's health? Did they use them as political pawns? Now, we've been told it was 21 days that they needed to be set aside, also 42 days. We were even told 7 days at one point. Her daughter, Jalaa, who had been a caretaker of Mr. Duncan before he was taken to the hospital, was told 1 week after he went to the hospital by the CDC that she could go back working as a healthcare worker. She wisely decided not to do that, not to expose people to that risk. But we've seen 21 days, 42 days, 7 days. Which is it?
The fiancé of Ebola victim Thomas Eric Duncan will be released from quarantine today. However, the CDC mandated 21-day quarantine period Louise Tro, along with her son and two nephews, endured is only half of the recommended period. The World Health Organization states, recent studies conducted in West Africa have demonstrated that 95% of confirmed cases have an incubation period in the range of 1 to 21 days. 98% have an incubation period that falls within the 1 to 42-day interval. The World Health Organization is therefore confident that detection of no new cases with active surveillance in place throughout this 42-day period means that an Ebola outbreak is indeed over. Drexel University professor Charles Haas released a study of the literature behind the Ebola incubation period. The 21-day incubation period is based on the general rule held for all infectious diseases. The lower the initial dose of the microorganisms you have, the longer it will take for them to accumulate to a critical level. Haas discovered that according to the statistics generated from the Ebola outbreak, in Sierra Leone, Liberia, and Guinea, and the earlier outbreak in Congo in 1995, there is up to a 12% chance that someone infected with Ebola may take longer than 21 days to show symptoms of the disease. The World Health Organization does not declare an Ebola outbreak contained per country until that country has passed the 42-day incubation period. Nigeria reached the 42-day milestone after an outbreak of 19 cases began on July 23rd. The clean bill of health for Nigeria can also be attributed to the rapid shutdown of its borders with Cameroon, Chad, and Benin. The death toll in West Africa has now reached 4,500 people. John Bound for Infowars.com.
All of this as to whether or not it's 21 days or 42 days, and of course the 42 days was the milestone at which they said that the outbreak had been contained in Nigeria. But this confusion over the number of days that people need to be quarantined is not limited to just that one item. As we learned from Reuters today, they say using military and new protocols, the U.S. is going to ramp up its Ebola response. Well, what is that new protocol? Well, they say the government's new guidelines, which a top health official said could come as soon as Monday, were expected to tell healthcare workers to cover their skin and their hair completely. That's right. That's a new protocol. So that wasn't something that was there a month ago or even a week ago, but now they're admitting that they made mistakes. Obviously, they've made mistakes because we've seen healthcare workers come down with it at the same rate of transmission as we saw in Africa. In other words, for every person getting the disease, it's transmitted to 2 other people. That's the same rate of transmission we've seen in West Africa. But they're not getting serious about it just because they're using the U.S. military. They're going to be using the military in a way where the military is still not going to get access to hazmat suits. They're going to use the same kind of health protocols that they were using yesterday, last week, a month ago. As reported today, and Paul Joseph Watson had on Infowars.com, feds stockpile protective gear in expectation of an emergency event. He said they're stockpiling a year's worth of personal protective equipment. And this is from a solicitation that was posted on FedBizOps detailing how the federal government is looking to secure face masks, medical gloves, shoe covers, lab coats, and coveralls to last 1 full year with an option for another 4 years. And to keep in mind, as he points out in this article, it was just last month that we reported that a supplier to the U.S. government, specifically to the State Department, gave them 160,000 hazmat suits. They bragged about that on their website, and of course their stock went up by 40% because of this large order. Yet none of that is going to be going to the U.S. military troops that are being injected into the heart of the outbreak in Liberia. The Daily Mail points out that U.S. troops deployed to battle Ebola in West Africa will not be equipped with hazmat suits. Here's what they're going to be given. They're going to be given masks and gloves, period. Nothing to cover their arms, their skin, their hair. They're going to be given just masks and gloves. And of course, they say that's fine because they're not going to come in contact with anybody there, except that there are thousands of people in the area who have been diagnosed with Ebola, other people who have been exposed, who may be symptomatic. They cannot guarantee that they're not going to come in contact with those people, but that's what they're going to do. They're going to bring it back with those thousands of troops who are not going to be given adequate protection and injected into the heart of the epidemic. But don't worry, because the Pentagon has a quick strike team. Reported today by Kurt Nimmo, he says the Pentagon says Ebola strike team does not violate the Posse Comitatus, according to a Pentagon spokesperson. This is Rear Admiral John Kirby, and this is on Monday, and he's the press secretary for the Pentagon. He said, this isn't going to violate Posse Comitatus. He said, we have legal authority for this. Well, Kurt Nimmo breaks down the history of Posse Comitatus. Of course, it was a law that was created in the aftermath of the Civil War. Things got pretty nasty at that point during Reconstruction. To pull that back in 1878, after a long period of abuses, they wrote a specific law. But of course, it goes back much further than that. It goes back to our experiences during the Revolutionary War, all the way back to the Magna Carta. As he points out in the article, in 1327, Thomas, Earl of Lancaster, argued that as long as civil government is able to enforce the law, military involvement in civil law enforcement is unlawful. But as we've reported, and as it's cited in this article, back in 2009, Homeland Security Journal was quoting a retired colonel saying, we don't need Posse Comitatus anymore. Specifically, what he said is it's not only irrelevant, but it's also downright dangerous to the proper and effective use of military forces for domestic duties. I couldn't disagree more. Now, as we just pointed out, the troops that are headed into harm's way in Western Africa and into the Ebola epidemic are not being given protective suits, just masks and gloves in some cases, but they're also not being given any training. Stay with us right after the break. We're going to have that report from Joe Biggs, as well as a man sentenced to 2 years for the heinous crime of printing a gun. We'll be right back.
DNA Force.
When cells become toxic, they die early and aging sets in.
DNA Force.
No one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. Just one of the key compounds, BioPQQ, is backed by major clinical studies.
DNA Force.
We now have the synergistic solution. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139.
DNA Force.